I was born without a country, no papers, no right, just a name and a struggle inherited from the war. My first home was a refugee camp in Pakistan, where my parents with thousands of Afghans fled the country while the Soviet Union was invading. My parents lived there for 20 or 25 years. I was baby growing into a small child. I didn't know what was going on there. I was I was young. It's kind of hazy in my mind, but I have these glimpses of memory of feeling too tired, not wanting to eat, wanting to sleep, and drinking water for several days. Later, I found out from my elder sibling that I had measles at that time. There wasn't enough accessible primary health care services, so I had to go through it. I, as a refugee girl in that camp with my family, suffered from preventable diseases, complicated with lack of clean water, sanitation, and lack of public health intervention. In 2002, when the Islamic Republic of Afghanistan established, it was deemed safe to return back to home country. So at age 4, I got to go to my country for the first time and start a new life from zero in a small rural village. We are deep rooted with patriarchal beliefs, dedicated that a girl place was in the home. But my father wasn't like them. He was ahead of his time, and he believes on equal education for men and women. And he wanted us to be educated. So he always told us, education is important for all of my daughters and my sons. I started going to school for the first time in that village with the establishment of the first girls' school. Most of my classmates thought that education was only for boys. Some dropped out, others never had the chance to start. People in that village were also affected by long war and lack of public health intervention. There was children with movement disability due to polio, or elders who had lost their hands and legs on bomb explosions. However, I remember one day at school when we were given a small pill with oral liquid. I didn't know that on that time, but that moment really shaped my future. The pill was albendazole, meant to kill parasite, and the oral liquid was vitamin A and polio vaccine. It was my first lesson in public health, a lesson that would stay with me forever. When I was 10, my father decided to move to big city for my elder sister education. If we stayed in that rural village, we wouldn't be able to pursue higher education. So with this, I got my degree in public health. However, building a career and contributing to the betterment of my country in a male-dominant environment wasn't easy. You know, working hard for 4 long years as a student to get a 4.0 GPA, but still not getting a job, it was tough. I remember I told to my dad, "Hey dad, I'm not able to make money. I can't financially support family yet." But he supported me, and he allow me to follow my dreams. And he told me, "Go and do what you think is best for you." To gain experience and learn skills to work independently, I worked as an unpaid intern at the Ministry of Public Health for a year. Fortunately, this led me to a paid position on that office where I focus on maternal and child nutrition. And later at UNICEF, I played a key role in implementing programs to combat malnutrition among women, children, and adolescent girls. I contributed to the team effort to include maternal nutrition at the National Nutrition Strategy and Policy for the first time, developed training package, operational guidelines, and launched the first maternal nutrition training for all nutrition workers across the country. And when the COVID-19 shut down the schools, I worked to shape the nutrition program from school to community. We not only covered schoolgirls, but out of school girls who were often forgotten. So life felt wonderful at that time. I had everything, I worked so hard for it. The job I wanted, the opportunity to make real difference, and more than everything, I was working for the women and children of my country who are the most vulnerable among us. But that time was so short. It was just 4 years, and everything changed. The Taliban took over. And in a matter of hours, everything we built was gone. Women pushed back into shadows, banning from school, stripped of their jobs, and erased from the society. For me and my family, there wasn't any choice, just to flee. Lifting my country was not just leaving my home, it was leaving my identity, my dreams, and my purpose. When I arrived to United States, I was grateful for the safety, but soon I realized that survival in a new land comes with its own struggles. I applied for over 100 jobs in public health, but I heard nothing back. My visa status made the higher education nearly impossible. Out of state tuition means paying double what the resident paid. The career I built, I worked so hard for it, was stripping away. I felt invisible, and for months I felt devastated and rejected. When I was about to lose hope, I found the Peter Salama Refugee Scholarship, a scholarship designed for people like me, for those who lost everything in their life, but still dare to dream. Before applying to the scholarship, I had mixed kind of feeling. I was afraid of being rejected because the scholarship was super competitive and only one person would be awarded. Plus, I was living in Atlanta, Georgia, and the school was in Maryland. So that means leaving my family, who had always been a huge support system for me. And also living by myself, it was a scary, new experience and unfamiliar. But as always, my father supported me. He not only gave me the permission to come here by myself, but he encouraged me and he told me, go for it, you can get it. When I was accepted, I felt something I hadn't felt for a long time, possibility. As a student and now as an alum of Hopkins, it gives me identity. I'm a voice, a bridge between the world I left behind and the world I'm building. I'm learning, growing, and preparing for the day to use my knowledge to uplift others. Today marks 1,235 days since the announcement banning girls in Afghanistan from secondary education. They are prohibited from higher education, working outside of home, and raising their voice in public. What's happening right now in my country makes me feel sad and devastated. And there's nothing much I can do for it. Just to empower myself. Though the road is long and uncertain, I know every step I'm taking to empower myself and to grow make me closer to the day I can bring changes and help the women of my country.